Everyone loves the aesthetics and beauty industry, but you never get to see everything behind the scenes. It's for authorized personnel only. But now, you're being authorized.
We are in the operating room today.
Blow the dice for me. Put your pretty ass lips together, blow real nice for me. Yeah, I'm trying to hit a lick and slide to the dealership in the morning. Wow, Papa need a brand new foreign. I leave it, but check the recording. Ooh, touch that, up a few bags. Big booty hoes meet me in the pit. Bar full of liquor, cash for the strippers. It's gonna get weird tonight, so no, just put some money to blow. I'm about to buy Las Vegas after this roll. I'm about to buy Las Vegas after this roll. Come on, 7, let's go. Yes,
Naked Beauty Podcast. We have an excellent show for you today. I've got an amazing guest, good friend of mine, and I can't wait to get him on. He is, you know him, I guarantee. Anyone that has social media knows him. He is America's holistic plastic surgeon. We are honored to have Dr. Tony Youn on the show today. Want to begin by talking about that idea of holistic plastic surgery. Something that when I started my practice, I was doing something similar. I actually have a page as part of my philosophy of practicing holistic plastic surgery. The idea that plastic surgeons don't just cut excess skin out, move things around, that we're really trying to take care of the whole person, and there's a lot that goes into it. So having an operation doesn't necessarily mean showing up the day of surgery, being knocked out, having us do our stuff, and then sending you on your merry way. It actually has a lot more to do with your overall well-being. So, with things like having you see a nutritionist or consider your diet, having counseling, so that, say we're doing liposuction, you're going to have better, longer-lasting results with the improving your dietary habits. Things like giving you herbal supplements that help you with your healing, other things that help you with your healing, some of the stuff we're going to talk about on the show, all looking at the whole person, trying to get the whole person into our paradigm, trying to take care of everything from start to finish, not just holding the knife and putting some stitches in. And the guy that has really advanced that idea more than anyone in the United States is Dr. Anthony Youn. Tony, let's bring him on. Welcome to the show.
Hey, thank you so much for having me on. I appreciate it.
Oh, it is my pleasure to have you on. Let me, Joe, grab that and just let me get my audio feed. Somehow we got it screwed up after I had it set. It's not that. We have this. Yeah, you can just shut that. Okay. All right. Well, I think we're good. All right, Tony. So, thanks so much for being here today.
No problem.
We have a really great discussion to have here. There's so many things I want to talk to you about. I most recently read, of course, your newest book, Younger for Life. And
thank you.
It just spectacular. And well, what I want to do is talk to you about. Joe, just leave it. Just leave it. I want to talk to you about a little bit about the string of books that you've written. Right? You wrote. The first book was In Stitches.
In
right?
Stitches.
Right.
Yep.
And then The Age Fix came after that. So In Stitches, the story of your journey through your medical training.
Yeah. So In Stitches came about. Honestly, I'm a buddy of mine who I was roommates with in medical school. When we went through medical school and we got into residency and stuff, we were talking and we said, there has never been a book written about the medical student experience that we thought was accurate. They're all written in this kind of over pious type of manner. And in the end, you're a medical student, you're essentially a glorified undergrad. And so that's what we set out to write together. And that became my memoir, In Stitches.
Well,
and
that
so
just
it covers growing up all the way to graduating medical school.
And that just was the beginning of your prolific writing career now. The Age Fix was, when I took a look at Younger for Life, it seemed like The Age Fix was the precursor, and in Younger for Life you talk about that. It kind of you shifted your perspective, looking from outside in versus inside out. So
Yeah, yeah, and that's exactly the case. When I wrote The Age Fix, it really came from a more traditional perspective of a plastic surgeon who went through 4 years of medical school, 3 years of general surgery residency, 2 years plastics, a year of fellowship. But honestly, I didn't know anything about alternative medicine, about holistic options. And after I wrote that book, I had an event where I had a patient who had a terrible complication, and it got me to really open up my eyes to relook at my practice and how I practice actual plastic surgery. And I started studying like I had never studied since I was probably in medical school, learning about nutrition, about non-invasive options, about things like intermittent fasting, and that became this concept of autojuvenation.
well, I love that term, by the way. There's a term called prejuvenation, right? The idea that we have of doing treatments to try and maintain, keep people looking young before they start showing the signs of aging. And the prejuvenation idea is really based more like the age fix perspective, right? From the outside in. The autojuvenation, love that word, that concept, and that is entirely what you go into in this Younger for Life book.
Yes, and autojuvenation has 5 main principles, and it's the idea that we have internal regenerative abilities to turn back the clock naturally, but we have to give our bodies the right environment and the right tools to do so. And so it involves what you eat, when you eat, nutritional supplements, skincare, and non-invasive treatments. And so by focusing on those 5 things, I firmly believe that we can turn back the clock naturally. Now, it's not a substitute for plastic surgery. You know, if you've
I
got
sure hope
excess
not.
skin of your tummy, yeah, you need a tummy tuck. Like that's the only thing that's going to work for that. But I do think that we can get radiant skin, we can live longer, live healthier, be more active, and feel and look great as we get older.
Well, I've known you a long time, and I swear you're actually getting younger. I don't think.
I wish.
I'm watching the grays come out. You see, I got the beard going. It's almost entirely gray, and you don't have a gray hair on your head, and you're looking.
Oh, I do.
I'm thinking you're getting
yeah.
carded every time you go get a drink.
You're too kind, Adam, but no, time's
listen,
happening
man.
to me too.
Call it like I see it. Before we get into Younger for Life, Playing God, really enjoyed that book.
Oh, thank you.
And I wonder if you could just share with us, you have so many of these little vignettes, little stories that you write about. Tell me, what is your favorite patient story that either made it in maybe it's out of Playing God or something that's happened since, something you didn't make it to the book? When you think about just things you relate that are important to you or were impressionable, what's your favorite story?
Well, you know, we're both surgeons, and every patient that we see, we look at a risk-benefit analysis in our own head of whether this surgery should be done or shouldn't be done. And then every once in a while, you get a patient that you just have this idea, this feeling that you should toss that out the window and do what you think is just the right thing. So I had a patient who came to see me, and she was morbidly obese. She was on multiple medications, and she had a cane as she walked in. And she said, "Dr. Youn, I have seen over a dozen plastic surgeons. Everybody has turned me down. I lost some weight. I ended up having a paniculectomy by a different plastic surgeon. And then I developed a major infection. I had tissue dye. And now my tummy is scarred in, and it's so painful that I can't even walk." And she said, "The one thing that's most important to me in my life, I cannot do. I cannot play with my grandchild." So she looked at me with tears in her eyes. She said, "I know I have a lot of medical issues. Everybody has turned me down. You're my last chance, my last hope. Will you please help me with my tummy?" And so that was a situation where I looked at her medical history and her meds, and it's just like everything is telling me, my head is telling me don't do it.
Yeah.
But I had this feeling that it was going to be okay, and this woman needed my help. And so we did go to surgery. The operation went perfectly, and she healed absolutely perfectly
That's
afterwards.
great. And you did a general
And
anesthesia with, despite all that?
yep.
Yeah.
Yeah. So basically, she had necrosis. So she had basically her abdominal, it was a kind of a paniculectomy slash abdominoplasty. And she had skin that had died. It was all scarred in. And I cut all of that out, re-advanced everything, sutured it shut, and she healed fine. So she came to see me a few weeks after her surgery, walking without a cane, and she had tears in her eyes. And she said, Dr. Youn, I am able to play with my grandchild again.
Yeah, that's
And
the
she's
best.
like, thank you so much. And then she asked me, she said, what made you do it? She said, why did you operate on me when everybody else said no? And I told her, I said, you know what? I just felt that it was the right thing, and that there was somebody above that was watching out for us, and that it was going to be okay. And it was. So
That's truly, literally a leap of faith then, huh?
it really was. And now that's not saying that, I get patients who come in to see me and I say, no, we shouldn't operate because it's too high risk. But just every once in a while, you just, these things happen, and you look back on it like years later and you're like, it's a little surreal. And you're like, did that really happen? And it's like, yeah, it actually did. And I think we all have these patients, you and I, we've operated on tens of thousands of people. And there are those patients that you just will always remember,
Yeah,
15, 20 years later.
we all have those stories, and that's the reason that we keep coming back. It's those moments, even if something simple like taking a dressing off and seeing someone's response, like, oh my God, I now see myself the way I've always seen myself. I remember I did just a simple operation, it's a chin augmentation on a young girl that just had a recessed chin. Pretty girl, but had a really weak chin. And the day after we saw her back in the office, and I will never forget, same kind of situation, never forget what she told me when, I asked her, well, how do you feel about it? She kind of got a look, and then she looked up at me and said, now I'm pretty.
Oh,
Yeah.
it's just,
Telling you the story, I feel it
Yeah.
tearing at my heart,
yeah,
honestly.
yeah.
But yeah, that's why we
Yeah.
keep doing what we do, right?
It is. It totally, and sometimes, like you said, it's those little things, but it's also, in stories like what I wrote, or they're the big ones too. And sometimes they're failures.
Yeah.
Sometimes in the book, there are patients who've died and who just, they kill you because you feel so bad.
Well, I don't think you ever let go of those. Thankfully, in what we
No.
do, there's very, very little mortality.
Yeah.
Even with the reconstructive cases, people do well, thankfully. But the
Yeah.
ones that don't do well, you never let them go.
No, and for me, it's like I always blame myself whenever there's a complication or
Right.
something like that, and I think that it's trying to learn from it. I have noticed in my practice, as I'm now in my 20th year of practice, it's like crazy when I think about it. The complication rate that I have is so much lower than it was in my first 5 years of practice, or even my first 10,
Yeah,
because
sure.
we learn
Experience
from
matters.
it.
Experience
It
matters for sure.
really. I think it matters a lot more than we realize when we're young surgeons, and we think
Well, we
we're
don't want to
hotshots
admit it.
just getting out there.
You don't want to admit that the older guys are probably better, huh?
I think they were. Its experience is huge as a surgeon.
Where I think I don't want to go too deep on this because I do want to get to a lot of the topics in the book. I don't want to miss out on that. But I think where this really comes down to is judgment. The people that have more experience know when not to operate. And just like you were saying, the story you told did not have all the red flags. You should not be operating on this person. All the reasons not to, and you just took a big leap of faith. But it's that voice in the back of your head that you listen to that says, "Hey, you might want to let this one go. This patient could have problems." And as you mature and get more experience, you realize how important that voice is. And when you're younger, you're hungry. You want to do everything.
Yeah, and I think as you have experience, is it worth taking that risk?
Right.
In this situation with this woman where her life was over, she said, "Look, my life is over, and if you don't help me, then I'm gonna just eventually just die and not feel fulfilled."
Right.
And so for me, it was worth that risk. That wasn't a purely cosmetic surgery. Sometimes
Sure.
purely cosmetic operations just aren't worth the risk.
I agree. We all know that. And that's it's making those choices that experienced surgeons. I think we lower our complication rates and just get better results because we know when the right time to do a particular procedure is and when it isn't. Yeah.
Completely right.
Yeah. So younger for life, autojuvenation. Give me. I've read the book. I have to tell you, my practice manager, my surgery coordinator, Barbie,
Mm-hmm.
would not put the book down. Went through it in a day when we finally got it in the office, and she gave
Oh,
me this
that's nice.
long list of notes that she had all kinds of questions. Actually, I have my copy here. I don't have her copy here. She had a whole bunch of questions for me to ask you. But going into autojuvenation, we talk about aging from the inside out. All right, trying to do the things that you can do to keep yourself younger, healthier from the inside out. And you spend a tremendous amount of time on diet in the book, even recipes. So, 3 of the best take-homes. Tell me what you think someone that hasn't had the book, the 3 things that they walk away from this podcast, what should they know about autojuvenation, particularly diet? 3 things you think are most important.
Yeah, so let me just, off the top of my head, the number 1 thing would be to eat more real food and less ultra processed foods. So here in the United States, we have food companies that have created foods that are hyper palatable. What it means is that they basically work in a factory with scientists to create food that you cannot stop eating. So for example, if you compare a bowl of strawberries to a bowl of potato chips, okay, strawberries are real food. They're made for us to eat. We eat them and you almost never will overeat them, okay? Potato chips, you put them in your mouth one by one, and you finish off the whole bowl, and afterwards, you don't feel so good, okay? There's very little nutritional value in those potato chips, a lot more in those strawberries. But these food companies know this, and so they create foods that we are going to overconsume. We are going to get addicted to them so that we eat more of them, and they make more money. And so in general, those are also the foods that are bad for us. They've got free radicals. They have chronic inflammation. And so the first thing I would say is focus on real foods as much as you can and limit the ultra processed foods as much as you can as well. Second thing, diet wise, is our skin is composed 70% of collagen. Collagen makes up that part of our skin that makes our skin firm, smooth, and youthful. And we start losing about 1% of the thickness of collagen every year, starting in our mid-20s. Women after menopause lose 30% in the first 5 years after menopause. And so what can you do? Well, collagen is a large protein. And so increasing the amount of healthy proteins that you eat as you get older can definitely help fight that process.
So collagen's an interesting thing because you also talk about taking collagen supplements, which I have to tell you, when I first heard of people taking collagen, I'm thinking to myself, you're going to eat this complex protein. It's going to hit your stomach acid. You think you're going to be absorbing this. Somehow it's going to make its way into your skin. It just seemed really far-fetched to me. There has been some research that shows that the collagen content over time, over a long period of supplementation, seems to have benefit.
Yeah, so it's the same idea that there's some people say, oh, if you've got an unhealthy liver, you should eat liver, and that's going to make your liver healthier. That's not true. If you've got heart disease, then eat beef heart, and that's going to make your heart better, and that's not true. So why is it that eating, let's say, collagen-rich foods or a collagen supplement is going to make the collagen in your skin better? Well, the first argument that you made basically is you said, okay, collagen is a large complex protein. And the idea and the studies actually focus on hydrolyzed collagen peptides. And what happens then is you take that large collagen protein, you break it down into individual amino acids and small chains of peptides. That makes it bioavailable so that you actually absorb it through your gut. Now, there are studies that have looked at people who've been on collagen supplements for 2 to 3 months, and they have actually drawn their blood and found an increase in collagen and pre-collagen, pro-collagen proteins in their blood, as well as taken biopsies of the skin and found an increase in the thickness of collagen in the skin as well. So I can't tell you exactly why it works, because why is it that you take a collagen supplement and you find the collagen in your skin better? But there have been multiple meta-analyses, one actually that was published after I submitted my manuscript for my book, from 2023, of over 1,700 people found an increase in hydration and thickness of the skin after taking collagen for 3 months.
Now, talking about hydration, water, just drinking water, as opposed to drinking, sugary drinks. So we all love the soda. People drinking tons of coffee. All of that is not great for your aging process.
Yeah, and I think there definitely, you want to make a difference between coffee that's black, which actually can be very good for you, and these Starbucks like mocha frappuccino types of stuff. And so definitely there is a thing, and really where I focus on for something like that is sugar. Sugar is really a great ager of our skin, and it ages our skin through the process of glycation. And at the same time, you can also get collagen spike. I'm sorry. I hear myself. It's echoing. Yeah, big time. So it's distracting, but
Okay.
I don't know if there's anything you can do about it.
Let me see if I can get that done.
It's been going on since we started, but
We got someone here.
oh my gosh. What is this guy doing?
Listen, ladies and gentlemen, you can't see this in the podcast. We're going to get we have a surprise drop-in today. We've got Dr. Ricky Brown joining us.
Oh,
we got him, Joe?
My Lord.
Oh, wait a second. We got another drop-in,
no.
surprise drop-in. Wait a second.
My two greatest enemies have joined us here.
I heard the number 2 Korean plastic surgeons was going to be on your show.
Oh, my Lord.
So I had to hop
Charlie.
in.
Why?
We've got Dr. Ricky, Dr. Charlie Lee.
What?
I think there's a little bit of...
Where did you dig Charles Lee out of? What hole did he come out of?
Charlie and
shouldn't he be at some K-pop concert right now?
I don't appreciate you talking to Dr. Lee.
Where's your bomb? Where's your
toilet Riz.
You guys have not necessarily, may not be aware, but we've got 3 of probably the most famous social media plastic surgeons on at the same time. And I heard, I thought, listen, Tony, you do a lot of media. You understand that controversy is good for a show, right? And there's so yeah, I thought it might be a good idea to have you just have a little chat with Ricky and Charlie and see what happens, see how it goes. So you guys were so gracious to come on, but I'm honored to have.
I need to just say that Dr. Charles Lee has Skibbity Ohio Riz.
Wow, Mike,
he stole my line.
You should see his Giat.
What about my
go
Giat?
ask somebody.
Have you seen my Giat?
See, I told you should see his Giat.
My Giat's better than your Giat.
Right now, every one of my teenage listeners and followers and watching this is cringing like hard.
Yeah.
These 4 middle-aged men speaking.
Yeah, you got my
Vibes
2 greatest
off.
ops on your show now. All of a
Right.
sudden.
We're only
definitely
here
off.
because we love you, Tony.
It's all Tony, this is your plastic surgery.
This is a nightmare. No, this is my plastic surgery nightmare.
Charlie, if you could turn your phone to the side, if you're on with your phone, just flip it sideways so we can get you there.
No, then you got to see his Giat if he does that.
You
That's
can
the
see my Giat a
problem.
little bit better now.
Yeah, width.
Oh wow! And flip it back. It ain't working. You can flip it back, Charlie.
Flip it back.
I can never unsee what you just did.
So Tony, now you know, right? So yesterday when they called me, I was like, I don't know what they're talking about because no one said anything. And then finally one of my girls runs back here after I texted you and was like, they said don't say anything. And I was like, well, they should have said that first. I didn't know who it was.
Oh, nice.
The cat was out of the bag. You're a smart guy. I'm sure you figured out something was up.
Well, I told him, I'm doing a podcast with is Adam calling you? Like maybe how would they mix us up? That doesn't make any sense, but it makes sense now.
I denied.
So much alike. You and Ricky are so similar.
I know, right? Exactly.
Yeah, we have the same amount of hair on our head, right?
Hey, you leave my hair alone.
Yeah.
So Charles and I go way back when I was a fellow in LA.
Yeah,
I spent a few days at his office back then.
Yeah.
He was one of the kind ones that would show me how to do different operations.
Yeah.
And so, so it's funny. It's
Yeah,
funny.
long time.
Well, actually,
And now he's like the hottest social media guy on Instagram.
I know, Dr. Lee, you're tearing it up, buddy.
Well, it's funny you mentioned in training with Charlie and I met when I was a student and he was a resident in plastic surgery. That's how we met too.
I remember.
Was that like in the 40s or 50s or when was that?
Listen, don't let the gray beard fool you. I'm pretty sure.
Oh my God.
That's so funny. Well, hey, but Tony, all joking aside, your book is great. We love what
Oh,
you're
thanks, man.
doing. We obviously support
Yeah.
you, and we're glad that
Yeah.
you're
No, I
making your
appreciate it.
tour and you're doing good things, even though you're
It's all
number
good.
two.
It's like 1:30. You guys should be all seeing patients. I'm at the end of the day,
Yeah.
both Adam and I.
No, I know.
We only
I'm in
work
the
a
middle
couple
of-
days a week, man. You work every
Yeah.
day?
Making these types of things, Look at
Yeah,
this.
well, you guys are content wizards, right?
All right, who is this, Charles? Which one is
What's
this? Which one is this?
Oh, I mean that's one of the BTS members. I can't see exactly which one it is. I think your
Man.
favorite was. Isn't your
Yeah.
favorite? It's not. It's not
Tony,
Taonu or.
Who was it that people were constantly
That's
liking
J-Hope.
you to?
J-Hope.
J-Hope.
Right, okay. I was gonna say, you have
I'm
your
too old
favorite.
now. Yeah, now
Yeah.
I'm too old. They won't.
Man,
They
you
won't
haven't
like
aged a
me to him.
minute. Jesus Christ.
I
not at
wish,
all.
man.
Okay, I got to tell a Tony Youn story. So my daughter's prom was a couple of weeks ago, and my daughter said, "Hey, Dad, you're famous. My friends all know you." I said, "Yeah, I know, I'm famous." And he goes, "Yeah, they think you're Tony Youn." I'm like, "Oh my God, no! He's my ops."
We all have a
you're-
little catching up to do, right?
You're doing great now, though, Charles. It's great to see how people just love your stuff, man.
Yeah,
It's
it's
so
interesting.
funny. I love it. I love
Yeah.
it so much.
Yeah,
I
Ricky's
gotta
gonna try to
introduce
poach
you.
your social media person.
I know you got it, and she's so great. I mean, it's like serendipitous that I got her, but she's helping all my friends around here. So I'm not her only account anymore.
Oh,
She's
really?
too busy to see me now. But-
All right,
Oh,
guys. Well,
geez.
if
Well,
you
she's
guys
doing
have
good.
a couple of minutes, there's a game that we were going to play, just me and Tony. But as long as I have you guys, maybe you stay on for a round.
Sure.
how quick? I actually have to run back. Unless is it real quick?
No, go ahead, Charlie. We'll let you. Go. I
They were
appreciate you
flipping my
popping.
patient over, so I just came
Oh
to
no!
pop
Yeah,
my head
go
out.
back.
Get back in the operating room.
All right,
We're looking
man.
for
Yeah,
it.
And
drink
Ricky,
that
I'm glad
Gia.
to see you
He's
in
got to
real
get
life.
back
Yeah,
into the
yeah.
operating room.
All
He
right.
scrubbed out really quick.
Go work on that Giat. Good to see you, Charles.
Take care, Charlie. Thanks, man. All right. You have any time, Ricky?
Yeah, I'll give you a minute, and I don't want to
Okay.
hijack Tony's.
We'll do
Tony's
the first
No,
one.
it's no big deal, man.
We were setting up to do 2 truths and a lie, and you guys have seen this before. I'll start with one of mine. Tony sent a couple, and I haven't. I actually haven't seen them at all. I know we got them, but I haven't seen them. But I'll start with one of mine. Actually, let's go to my second one. Tucker, can you grab those 3 items so I can, for the next one, I can show them? So I'm going to tell you 3 things. One of them is not true. 3 things about me. The first one is I played a 4th of July concert for thousands of people. Second one is I sat in with a wedding band in a wedding where I didn't know anybody and I was not invited. And the third one is I won a karaoke contest while I was in my plastic surgery residency in Houston. One of those is not true.
I would say this. I would guess maybe the second one.
Okay, the second
Yeah,
one,
I would
the
say
wedding.
second one. Yeah, I'd say the
Okay.
second.
Actually, the wedding is true. I did. My dad was a band leader, so I used to sometimes tag along with him. He'd be playing weddings, parties, whatever, and he was the drummer. And he when he would go up in front, maybe to do a little talking to the audience, I'd sit in on the drums and play. I was not invited to the wedding, didn't know anybody there, but I was with the band.
Oh, there you go.
That's right, I was.
Yeah.
That's right, the original, right? All right, well, Tony, you want to give us one of yours?
All right. So my first one is I played in an Eagles cover band as a resident. Second one is I collect old Marvel comic books. And the third one is I was sued for $150,000 for posting a copyrighted photo of Cyndi Lauper on my blog. All right. What do you think? Eagles cover band as a resident, I collect old Marvel comic books, or I was sued for $150 grand for a Cyndi Lauper photo?
Let's see. The 150 grand is so crazy, it's got to be true. So, and people sue for all kinds of stupid things. So I'm not entirely. I mean, it could be false, but I'm going to go with that's too nutty to not be true for this kind of game. So I'm going to go. I mean, the Eagles thing. I'm a musician. I think it's not unlikely you played. What was the second one?
I collect old Marvel comic books.
That's so easy to believe. I'm going to switch directions. I think I'm going to go with the Eagles cover band.
So yes, I was sued 150 grand from a paparazzi for posting a photo of Cyndi Lauper on my blog, and it almost went to court. We settled out of court for like 3 grand or something like
So
that
silly.
with my insurance company. I do collect old Marvel comic books, and I played in a Jimmy Buffett cover band as a resident.
I just changed the artist.
Yes,
Look at
Jimmy
that twist.
Buffett. Yes,
All
yes.
All right. So let me go on to my next one if you guys want to continue. I've got 3 items from my travels. This is a ear of corn taken from the Field of Dreams. This is a baseball used from the All-Star game, the MLB All-Star game. And this is a puck from the Stanley Cup. One of those items is inaccurate. That's just NHL logo on it.
Yeah.
And if it influences you, that hologram means it's actually real, memorabilia.
So I have been to the Field of Dreams. I took a trip out there with a buddy of mine, and it's really out there. But I think to go and take an ear of corn would be stealing. So I'm going to guess that the ear of corn is probably not correct.
Okay.
But then why does he have it sitting on an ear of corn in his office in the middle of July? That's the weird thing. So.
All right. So, Ricky, which way you're going to go? You're going with the corn? You're both wrong. This is actually a piece of corn from Dyersville, Iowa. I did.
Steal it from Dyersville.
Yeah,
yes,
lock
I've
me
been
up,
there.
man.
Yeah.
Yeah, isn't that great? Great field.
Oh, yeah.
I did go to the All-Star game. The ball is from the All-Star game. The puck is actually this one. I have 3 of these. This is an Islander puck. It's not from the Stanley Cup. It is signed by, this one's signed by Clark Gillies, and I've got Brian Trottier and Mike Bossy. But they're Stanley Cup champions, but not from the Stanley Cup.
All right. We're wrong, man.
Well,
Ricky and I don't know shit.
Well, not about my memorabilia anyway. All right, Tony, let me have your next one.
All right. So Ricky might know one of these at least. Number 1, my favorite fast food joint is In-N-Out. Number 2, the first television talk show I was on was the Montel Williams Show. And number 3 is I've attended 2 SAG award shows. So In-N-Out, my favorite fast food joint. First television talk show was Montel Williams, and I've attended 2 SAG award shows.
Okay. Well, In-N-Out, everyone loves In-N-Out, so it's not far-fetched. I'm going to say that that's true. Montel Williams, you've been doing TV for a long time, and so it's easy for me to believe that way back you did a Montel Williams show before you became Rachel Ray's go-to guy. So it's easy enough for me to believe. And the third one was the 2 SAG award shows, but you've been doing media so long, I have a hard time believing it's only been 2. So I'm going to go with the SAG shows.
Montel. Okay. So first show I was on was Montel Williams a long time ago, and it was run really poorly. I think we waited in the green room for like 4 hours or something to do the segment.
Holy cow.
I have attended 2 SAG award shows, so I have my SAG card. And the last one we went was right before the pandemic. And my favorite fast food joint is Shake Shack, not In-N-Out. In-N-Out's good, though. In-N-Out's really good.
Well, everyone loves it, so I figured, what the hell?
Yeah. Shake Shack, man. Yeah.
All right, let me see.
It is, man. It's good.
Here's my last one. So I know that's it for you, Tony, right? You gave us 2
Yeah,
sets.
that's it for me.
Right, so here's the last one before we wrap up this.
I can
this
make
game.
one for Ricky if you want.
Oh, well, I don't know. If he's into it, we can do it. First one, I won an award for watercolor painting. Second one is I came in first in a storytelling contest. And the last is I've been a member of 2 different magician societies.
Ooh, I would say the watercolor. I could see you telling the stories, and the magician is different enough that I bet you that's true. So I would say watercolor painting. Maybe I don't know that you're a painter. Maybe more of a sculptor.
All right, it's a good way to end. You guys are both right. All right, well, there you go. Thanks for playing Two Truths and a Lie here on the Naked Beauty.
Nice.
So let's get back into everything coming out that you're excited about. I want to talk about new things. And actually, Ricky, as long as you can stay around, it's all good, man.
Yeah, I
one
got
of
a
the
few
things,
minutes.
One of the things that I know, Tony, you and I have discussed this offline a few times, just at meetings here or there, red light therapy, things that we can do to help patients recover better, ancillary things, but specifically red light therapy. I'm seeing more and more excitement about it, a little bit more proof that it has some benefit.
Yeah, there are a couple of studies, not a lot, but a couple of studies that do appear to show an increase in collagen and elastin fibers in people who are using red light therapy. Typically, it's a couple of times a week, and each time maybe 15, 20 minutes. So you're not talking about a lot. So I do believe in red light therapy. The idea behind red light therapy is that the energy from the red light can help to basically energize the mitochondria of your cells to produce more ATP. And that's kind of the anti-aging benefit of it. I think it's important for people to realize, though, that red light therapy is different than infrared. So there's like infrared saunas, and infrared, you start getting into more of like the general kind of benefits. So red light goes more superficially, infrared goes deeper. That's going to be more of a longevity type of a treatment. And I think, Ricky, you've recently started doing cold plunging, right?
Yeah, I mean, I've done it before and I just got one. And I got to start posting about that for them. But yeah, no, and I got to tell you, for cold plunging, I don't know that we have great data on actual physical benefits, but I will tell you that the mental fortitude that comes from doing it is unbelievable. And I think when you throw yourself into a very uncomfortable situation and you try to coach yourself through mentally getting through that, for me, that's what I see to be the greatest benefit. And then maybe some anti-inflammation. But do you guys know, I haven't seen any great data that's compelling about it actually benefiting you otherwise.
Cold plunges? Yeah, no, I've heard
Yeah.
The recent things that I've seen have been actually to the contrary. That certainly is anti-inflammatory effects just from the cool temperatures, but it also seems to decrease healing because of that. There's some evidence that it, for someone that's healing to do, say, cryotherapy and recovery, it may not be the best thing. Obviously decreases blood flow, may decrease actual ATP production. So I'm not a fan of cold therapy. I'm in Miami, guys. I like it hot. So, when I train, if I go and do something, I'm the guy that's going to get in the hot tub. Normally you start off in the hot tub to start the day, right? That's how you loosen up. A lot of professional athletes will do that, have a hot soak, go do their thing, and then they hit the cryo tub afterwards for recovery. And that's been kind of the dogma for a long time. But now I think there's more evidence showing that heat seems to be better for recovery in terms of increasing blood flow and facilitating healing than we've seen with cryotherapy.
I think that really what you're looking at, though, is a concept of hormesis. So it's the idea you put your body through short periods of stress and that it activates longevity genes, and the idea of whether that stress is exercise, whether it's cold, whether it's hot. And you can even look at it with the treatments that we do. It's the same idea. If you like laser your skin, you create damage to the skin, and that kind of acute injury can create the actual body to be tighter and more youthful afterwards. And so that's, I guess, kind of the way that I look at a lot of these therapies. Is I think it's healthy to put our bodies under a short-term period of controlled stress, because in the end, that's going to be healthy for us. The worst thing is going to be just sitting on the couch and being comfortable all the time.
So what do you guys think of the cold shower after finishing the hot shower? Just turning it down, giving yourself a freeze before you get out of the shower. That's the kind of stimulus you're talking about, right, Tony?
Yeah, and I can't do that because I'm a wuss, and it just.
Yeah, I'm right there with you. My wife does this on the regular. I cannot. I can't stay in there when it gets too cold. I just won't do it.
I do it, but I have to look up at the spigot and talk mad trash to it when I do it. Like my wife will come upstairs because we're doing the 75 hard program. We've done it a few times, and part of that program he has a year-long program is you have to do a 5-minute cold shower every day. And my wife would come upstairs like, "Who are you talking to up here?" I'm like, "To the spigot, because it's cold under this thing."
Man, I can't do it. I just can't do it. I'm again, Miami, guys. I can't do it. I don't
Not
do
Yeah,
being,
cold.
I
you know,
think
Arizona's not
I
cold.
do a
That's for
little of
That's
it,
true.
but I don't like 5 minutes a day. That's crazy. I mean,
Yeah,
good
it's a
for
lot.
you, Ricky. That's
I
tough.
don't do that, but the cold plunge, I'll tell you, we have it set at 45 and 3 minutes
Mm.
seems
Oof.
like an hour. It's
Yeah,
insane.
Man, 3
yeah,
seconds seems like an hour to me. Jesus Christ.
yeah.
All right. Exosomes. This is probably the single hottest advance in the last, year, 2 years, 3 years in our field. People are talking about exosomes, beginning to use it in all sorts of ways. I look at it as the new wave of stem cells, but looking at how exosomes work, are we cutting out the middleman and just are we bypassing stem cells altogether? What do you guys think of the potential for exosomes, their current use, and are stem cells gone? Are they dead?
You want to start, Ricky, or?
No, you go for it, man. This is your gig.
No, it's all good. So exosomes, basically, the way we look at them is these are like cellular messengers. So when you look at peptides are proteins that are cellular messengers that basically message our cells to create more collagen. The difference between that and exosomes basically, the way I kind of describe it to people, they are basically these packets that can contain information. And that information can be anything from healing a wound faster to creating more collagen to various other types of things. Where it's a little bit questionable is that the FDA does very strictly now regulate stem cells, and my understanding was with exosomes too. So I'm not sure where the line is drawn for legally using them, although I know that there are certain skincare brands now that are using exosomes. To my knowledge, the only science that's truly been out there that has been, I think, peer-reviewed and supported are studies that show that using exosomes for wound repair have been helpful and seem to have good promise. But I have not seen any true studies on the aesthetic benefits, reducing wrinkles, tightening skin, and that type of a thing.
Yeah, I agree. I got to tell you, I mean, we use them. My nurse injector does use them. And it's so hard to know who is really truly getting the benefit because of the exosomes, or was it just the microneedling that worked? And as Tony alluded to, this is so hard because this is our industry now. Everyone is looking for something that's like the magic thing.
Right.
And
The
I
next
feel like
best thing.
it gets so hyped and so oversold. And I feel like, sure, the right patients might get like legitimate results that someone else doesn't get, but that doesn't mean that they're the end all be all. I think it's really sporadic who gets a good result. And, again, there's like every time we turn around, there's like a new thing, I feel like.
Well, when it comes to exosomes, you're right. There's not a lot of clinical data yet, but in terms of aesthetics, there has been some clinical publications, some studies that have shown hair growth benefit. For using it similar to PRP,
Yep.
and it does seem to have benefit there. We've seen the wound healing benefits as well. So, because the exosomes are those little packets like you're talking about, I think we're getting them from stem cells, right? That's how they're manufactured. They culture up a bunch of stem cells. They isolate out the exosomes from the stem cells. So that's why I think about it as kind of cutting out the middleman, and we're kind of bypassing the use of stem cell therapy, especially in the United States. And legality, just to clarify that, you can use them topically. You're allowed to use them because they're basically like a SkinCeutical type of a thing. It's a topical application. Is not a drug, so it doesn't require the same approvals that it would if you're trying to inject it. So you cannot inject exosomes, but you can place them topically. And so the answer's been, Ricky, like you're talking about, using the microneedling to kind of punch it through the skin to create channels and have it absorb through. And particularly in the scalp with hair, that has seemed to have been beneficial.
Yeah.
So they're not you haven't seen them injected into the scalp then,
Not
like
in this
with PRP.
yet. Yeah, not in this country yet.
Yeah,
I'm
because
actually,
PRP you've got to inject that to really
Yes.
see those benefits.
Yeah, and I'm bullish about the injectable use of exosomes once it's approved. It kind of got lumped in with that whole stem cell controversy, and
Yeah, I know.
I hope it. I don't want to see this to be a barrier for advancing, our science. Compression therapy. We talked about cryotherapy and, for recovery, red light therapy. What do you guys think of compression therapy? Things like compression massage after surgery.
You want to go first, Ricky?
Yeah, and then I'm gonna let you do your thing and get out of here. I don't know a lot of the science behind it, right? We do it like you talking about the shock trousers and things like that, like after we talking about
Yeah,
those
well,
things.
I think they've come a long way since the shock trousers, the masked
But that's
suits.
what they look like, right?
Yeah, they do.
So,
They
the
do.
whole
Yeah.
idea of flushing lactic acid and all of that. I mean, I don't know. I mean, you could tell me. I don't know much about the data. I have not used it in postoperative recovery for patients, but we certainly use it. I'm a big CrossFitter and I hike a lot and do jujitsu, and we use them for recovery, and I do cupping and all that stuff. So I like it. I do feel like it helps me, but I don't have any data about patients postoperatively.
I would agree with Ricky, but the only caveat I would put to something like that is I do think that some people, honestly, some surgeons use the fact that some people maybe haven't worn their garments as an excuse of why they may have rippling or
Yeah.
complications.
Agreed.
I think you can reduce swelling with it. It's not gonna, it's something that long term, if you wear a garment for a period of time, that's gonna help reduce the amount of swelling, possibly reduce the amount of seromas, maybe even small hematomas and stuff like that. But I feel that it's not going to determine whether you get a smooth result or a not smooth result. It may get you faster to your final result, but if you don't wear it, you're still going to get there at some point. It just may
Agreed.
take you longer. That's kind of my feeling, because I have had patients tell me, "Oh, well, this doctor told me that the rippling is because it's my fault I didn't wear my faja," and it's like,
Yeah, my God, I hate
I
that.
do use foam compression though. I love the foam. I do when I do, Vaser and lipo, I put them in a piece of foam and then external compression for 3 weeks because I feel like that the faja, it sort of cuts into their skin sometimes and creates those ripples that eventually go away, and
yeah.
that the foam like gives them a nice smoother compression. But whether it really helps or not, I don't know. But I do send them for lymphatic massage, which I think is great.
Yeah,
Well,
but I feel like all of those are going to be to get them to the final result quicker versus give them a different result, and
Correct.
that would be my point with it.
yeah, I completely
So,
agree. We've been
yeah.
using the trauma suit that Ricky was talking about. There's a device called the Balancer Pro, which is excellent, and it has that kind of masked suit type of thing, comes up to the chest and goes all the way
Yeah.
down through the feet, and another one that's a jacket that you kind of look like the Michelin Man. You got your arms all bundled into it up to your hands, and it comes to your waistline. And it is probably the most effective lymphatic massage I've ever seen. And we really like it after surgery. But I agree with you, Tony. First of all, I never blame patients for failing to do some sort of supportive therapy after surgery as the reason why something just didn't go right. That's I think it's bullshit. And I think anyone that tells a patient that really is being unethical. And it irritates me because I get the same story sometimes from my patients that come for revisions from elsewhere, and God, it irritates me so much. But the compression with the balancer is something that is good, and I agree it doesn't really change end results, but it gets you there faster. Patients like it. It's a very soothing thing to have them do even just a couple of days after surgery. And I got to tell you, even outside surgery, after we're done here, I'm running to the airport. I'm going to the FACES conference in London. And when I fly, I love to jump into that suit and lay there and have it squeeze out the edema, because we all walk around with a certain amount of edema every day. And just having that firm compression, that lymphatic massage, can offload that fluid, and you physically feel a difference. If you do a series, you can actually trim down the circumference of your body in certain areas. So it definitely has benefit, but I agree completely about not giving better results, just getting you to hopefully great results a little faster.
It's like you should do those body wraps and then get on a treadmill like they used to do back in the early 2000s, man.
Yeah, man.
That vibrating, remember that vibrating thing they
Yeah,
put
that's
around their
right,
body?
yeah.
That was great.
Yeah, it's like
All right, guys.
the power
I got to
police
get
that
out of
people-
here. I'm going to let you guys chop it up. Tony, thanks for letting me crash
Hey,
the
good to
party.
see you, my
Dr.
friend.
Rubenstein,
Hey,
I
Ricky,
appreciate
thanks
you
for
having
coming
me in,
on,
my
man. I
friend.
appreciate it very much.
Yeah, we'll hook up
Take
another
care, Ricky.
time.
Be well,
Take
man.
care.
Bye-bye. So tell me about the skincare. I mean, you've really, as much as you've dived into nutrition, you're now a real expert in skincare, but in a granular way. I mean, reading your book, you're into the ingredients, even using natural things, which, by the way, I mentioned Barbie loved the book. She loves the homemade apricot facial that you have there. She loves it. So speak a little bit about what made you get into skincare? What was the motivation? And then give us like your again, the top 3 points on things to look for, things to do.
Yeah, so I think skincare is something I've always been really interested in, even when I was a resident, just because the aesthetics of aesthetic surgery has always been really my draw to plastic surgery. And so I have my own skincare brand called Youn Beauty. It's made with natural and organic ingredients. And really, what my story was like many plastic surgeons, I started my practice. I had, my general plastic surgery training, and I put certain skincare brands in my practice that we are pitched at our meetings. And I had a secret that I had for many, many years that I wouldn't tell anybody is that I sold a lot of these products. I promoted them to my patients loved them, and I couldn't use hardly any of them because whenever I put them on my own skin, I would break out in hives. I would be itchy and scratchy. I get red. And I had really sensitive skin. And so it wasn't until I started using products made with natural and organic ingredients that I found that, holy cow, I can actually put these on my skin and my skin feels better afterwards. But the problem with those products is that they're made with natural ingredients, but they don't have anything actually effective to turn back aging. And so that's why I started my skincare line, is to create one that actually has active ingredients like vitamin C, like retinol, like kojic acid, but also is made with natural and organic ingredients so that you don't have all these additives and preservatives and fragrances that are not necessary in these products. And so if that'd be the number one thing I would say, if you're looking at skincare, a quick tip is that if you apply products and maybe you've got hardy skin and maybe you can tolerate some products that have, more ingredients, more additives and preservatives, that's okay. If you tolerate it, fine. But if you don't, there are products that you can use. You don't have to be where I was for many years, just using basically a gentle cleanser and a very mild moisturizer and nothing else. Like, you can use products. You just want to go then for those products that don't have all those added ingredients.
Yeah, it's so important.
So
And
that's the first thing.
people don't realize how much junk there can be in skincare products, particularly over the counter. People don't even understand that there's a difference between something you might see just sitting on the counter at Walgreens and something you might get in one of our offices. That there is a tangible difference in the quality of ingredients and the formula that they're getting. That there's a value to what is admittedly more expensive products, but they're expensive for a reason.
Yeah. So that would be the first thing. I think the second thing would be second and third would be two products that everybody should ideally use every day. The first one is some type of an antioxidant serum every morning, like a vitamin C. That's most common. And then the second thing I recommend skincare is every night use some type of an anti-aging cream. Whether it's a retinol, which is most commonly used, bakuchiol is a nice ingredient, peptides. Now they're coming out with exosome-based skincare. Use something that has an active ingredient every night so that it's working on your skin for those 6 to 8 hours every night when you're sleeping.
Now, if you tolerate all of that stuff, bakuchiol is really a hot ingredient right now, and you will go into it a lot in the book. If you can use any of these, including retinol, are you shooting for the retinol at the top of your list, or do you think there's some benefit to kind of toning down with bakuchiol?
No, I think I would start with retinol. It's the most proven. It has the most studies behind it. Obviously, we know all about tretinoin, which is the prescription strength version of it. Well, retinol essentially, it's not a prescription medication because when you apply it, it is non-active. But once you apply it on your skin, it undergoes two chemical conversions. It goes from the retinol to retinal, and then retinal, it goes then to tretinoin. And so it actually turns into tretinoin on your skin with these chemical reactions. And so that would be the first thing I think would be always focusing on that, because that's what we know definitely works. However, you and I both know, and a lot of our patients know, is that it can be irritating to the skin. And for some people, if you use it long enough, 6-8 weeks, that irritation can potentially go away and you may tolerate it better. But some people just never really tolerate it. And that's where I would go for some of the other ones. Once again, peptides. I think bakuchiol is really nice. There was one study that compared bakuchiol to retinol head to head and found very similar anti-aging benefits. So if you've got real sensitive skin, then I would go for bakuchiol. If you've got more quote unquote normal skin, or if you've got kind of oily, thick, tolerant skin, then I would go for retinol.
Great. And your third?
Oh, that was my third. So 2 was vitamin C, and then third
the
was
vitamin C. Yeah, we kind of
retinol.
glazed over the vitamin C. Yeah, the antioxidant ingredients are all great. I mean, vitamin C being the king of all antioxidant ingredients. So, fighting the free radicals that the sun causes, fighting the sun aging. Give us, if you were going to tell a patient to use them, you're really into the homemade stuff. They don't want to buy any products. They want to try and do things the quote unquote supernatural way. What are they going to do at home? I mean, is there anything you can do? We talked about that scrub that you can make at home. Any sun protection that's natural? What can you do with just household things?
So yeah, I mean, it's interesting. There was a video that went viral recently about a big time influencer who said, we ran out of sunscreen, so watch my boyfriend make homemade sunblock. And that was roundly panned by dermatologists for good reason. So the best homemade sunblock really is going to be clothing. If you run out of sunscreen, then put more clothes on. Don't try to make your own sunblock because you don't know what SPF that might be. That's really what I would recommend. I mean, I suppose I've never done this before, but zinc oxide, diaper rash cream is zinc oxide, so you could apply that, but that's also going to be real tacky and white all over your skin. But other than that, really, I don't recommend kind of DIY stuff. In the book, there are some DIY for sunscreen. In the book, for people who have very limited budgets, can you make, let's say, an at-home, very gentle peel on your skin? You can, and it's very simple. You can take a simple fruit juice, like whether it's an apple juice, orange juice. Don't go with lemon. Lemon's so acidic that can be real irritating to your skin. But if you mix that with a little bit of yogurt or a little bit of honey or both, then you can create essentially a very natural at-home mask. And so those types of juices, they contain citric acid. That's an alpha hydroxy acid, so you can get some very mild potential exfoliation out of it. Yogurt has great fats, healthy fats in it. Also can be antibacterial as well. And then honey is antibacterial too. So there are things that you can do. Ideally, though, buying products are what I would recommend because those are going to work more efficiently on your skin. But if you're just on a major budget and you want to do something at home, then you could try these types of orange juice, apple juice type of concoctions.
Yeah, and there's so much good in the book. Again, if you guys are seeing this for the
you.
first time, Younger for Life, it is a really comprehensive view on autojuvenation, the idea of keeping yourself younger just naturally with good habits, good diet, and good skincare. What are you excited about? What's the future in our term? What's on the horizon that you really are looking forward to seeing?
Yeah, I mean, one thing that I have been refocused on, and you've been on my podcast before, is I've got a podcast. I renamed it from the Holistic Plastic Surgery Show to the Dr. Youn Show. And so that's something that I have refocused on recently. And that's probably the big thing right now is I'm finding that podcasting has been a lot of fun. I took some time away from my podcast. I did maybe 300 episodes and took some time away, and recently is getting back to that, and it's been a lot of fun.
Well, I mean, we're all grateful you're getting back to it because you always have such great content, and you speak.
Thank you.
You and I think share a certain sentimentality about just telling the truth about what's going on, really unmasking things and saying, look, this is the real story. So I've always appreciated that about you, and I love the content that you create. That just
thank you,
put it
Adam.
out there. Really love it. I'm happy you're back at the podcast.
Appreciate
medically,
it, man.
What's the exciting thing for you medically?
I think medically, one of the things that I have really been focusing on, honestly, has been reducing the number of procedures that I'm doing. I used to do rhinoplasties. I stopped doing those about 10 years ago. I used to do brachioplasty. I found out that, I'm not doing that many of them, so I stopped doing those. And I found actually a newfound enjoyment of operating now that I'm doing a little lesser operations. It used to be when I started my practice, and you may be in the same, we train in everything, from facial reconstruction to burn surgery to breast reconstruction to cosmetics and everything. And in my practice, I started out by doing everything. And little by little, I've kind of whittled it down. And as I have done that, I have taken out those operations that honestly I don't really enjoy doing. And those ones that maybe I didn't feel as confident because I didn't do enough of them. I just stopped.
What are your favorites now?
I don't have a favorite. Like I do a lot of breast augmentation, a lot of facelifts, a lot of tummy tucks, abdominoplasties, a lot of breast lifts, kind of the bread and butter stuff. And I don't feel the need to have to do some of the weird or the really big operations that are risky. I don't do body lifts. I don't do some of those really big things. And honestly, it's made my life easier in that I find that I'm more confident with what I'm doing. And I don't worry about my patients as much because the operations I'm doing are very controlled. And, there was actually a book from Atul Gawande, a general surgeon, called complications. And it was all about, how do you reduce your risk of complications? And there was a study that looked at these hernia centers and found that the lowest complication rates and those patients who had the best outcomes were done by surgeons who do the same operation over and over and over and over again. And there is a direct correlation to patient satisfaction and outcome in how many a surgeon does. And that's something that really, after I read that, I really resonated with me, because I'm like, I don't want to be a jack of all trades but master of none. I want to make sure that if my patient chooses me as their surgeon, that they're going to get the absolute best outcome possible. Right. And if I'm only doing a surgery twice a year, 3 times a year, then I can't feel confident that I'm doing the right thing.
Yeah, I think it's a fair point. But what about trying new technologies and new procedures? And we go to meetings, you see new techniques. Some of our colleagues come up with interesting ideas. Are you going to be one of those guys to try and
I still do.
Operating room? Yeah.
I do, but it has to make sense to me. Yeah. And so, for me, I'm not one that's going to just try some new operation I haven't done before, but will I change my operation a little bit to see whether doing this a little differently may help a patient? As long as I feel that the risks are significantly outweighed by the benefits. They say that the highest complication rate is right after our national meetings. And I think it's true. People try things.
Back. Yeah, that's true, man. You go back, you see something, oh, that's interesting. You come back and you try it. I think it's just not having been thought out well enough. You're just kind of diving into the deep end head first, and not always a good idea.
And there are little alterations you can make in an operation that can be beneficial versus completely doing a different technique and seeing if that works.
Totally agree. That's what I take home from meetings, right?
Yeah.
You see these little pearls, and you try this little thing, that little thing out, and maybe it does change the way you do things.
And some of them just make sense. So for example, one of the things I do are progressive tension sutures with my abdominoplasties, where you suture the abdominoplasty flat down, and I still put one little drain in, just a 10 French drain, just because I want to play it safe. But technically a lot of people aren't. And that's something that to me made a lot of sense, because it makes sense. It maybe takes another 15 minutes in the operating room. There's you think about what risk is this to the patient? It's kind of a no-brainer to try it. Those are the types of things I find a lot of enjoyment with, because you think about somebody thinks of something that's just a really cool idea, and you go, my gosh, why didn't I think of that earlier? Breast implant funnels, another thing, duh, it just makes sense. So those are the types of things I really get excited about.
Very cool. So media-wise, tell us what's on the horizon for you. I know you got your podcast coming. So do you have anything big coming out besides that? Are you doing any more TV? Any other appearances?
Yeah. So yesterday I was on live with Kelly and Mark. Actually, no, 2 days ago. So we've been doing that. And I do have 2 television programs that are in development, but it's so hard to get these things. You know that. You've done a lot of national TV, and it's like being struck by lightning. So we'll see.
Well, I hope we're sitting next to each other at a SAG Awards at some point together.
That would be fun.
Tony, I can't tell you how grateful I am to have you come on today. It's been so much fun talking with you. I feel like part of this, we're just kind of sitting at a meeting, shooting the shit side by side somewhere.
Yeah.
I remember we did a podcast once at a meeting. You just broke out your little camera and filmed right there. It was great. I hope we can do this again sometime soon. And
definitely.
Everyone, I'm sure, if you haven't checked out Dr. Youn's media, I can't imagine there's anyone watching this that hasn't checked out your media.
No, thank you.
But they need to. If you haven't checked it out, just really funny, honest, great information that you're going to see about just everything from the fringe ridiculousness in our industry to just the very basic, simple facts you need to know. Check out Dr. Youn on Instagram, TikTok. He's a king of social media, and I've been privileged to have you today.
Oh, thank you so much, Adam. You're a breath of fresh air in our industry, and you've been doing great stuff. So yeah, proud to call you my friend.
Appreciate that. Well, that's our show on Naked Beauty Live, our Naked Beauty podcast. We'll see you again with another great guest next month, and thanks for watching.